Hi, Jennifer DiCibella, CEO here at Hennepin Healthcare. And I want to thank you all for joining us as we reopen our East Lake Clinic. What an exciting moment for us, for our community, and a long time coming. Our clinic has been closed for over a year, and when we lost it to civil unrest over a year ago, our community rallied. They told us this clinic mattered. Our team members rallied. They clearly told us this clinic, this neighborhood matters. And we committed to coming back. And we committed to coming back dreaming big and coming back even stronger. What we have done is partnered with Hennepin County Social Services, Human Services, Public Health to dream big about what healthcare should look like in the future. And that health and wellness opportunity is what we've built with East Lake Clinic today. It is bringing together all of the services and supports that we've heard from community are so essential for their ability to thrive and be healthy. We've made it more accessible, and we're teaming together in new ways to drive healthcare of the future forward. I couldn't be more grateful. Our team early on, Dr. Coca, Chris George, Ryan Erdmeyer, all rallied and said, this is a neighborhood we cannot leave. The team at the clinic rallied and said, this is a community we must serve. And they didn't just do that in the long term, they did it in the short term, showing up with mobile supplies, a mobile van to create healthcare, bringing patients over to our Whittier Clinic. I want to thank our Whittier Clinic colleagues as well, who created a welcoming environment for the past year while we rebuilt the clinic. I want to thank our federal delegation who has come forward to provide support and advocating for us to get financial resources to rebuild such an essential service. None of this is possible without the patients and the community's commitment to us as essential partners as well. I couldn't be more excited to hear from our colleagues today. You'll hear from our chair of the Hennepin County Board, Commissioner Marion Green. You'll hear from Commissioner Conley. You'll hear from Dr. Susan Palchik, our public health director, about how all of us came together as organizations with community to vision big and to see what will make a difference in this community. And we are so excited today to open the doors, to realize patient-centered care in new ways, and to transform, making sure care is accessible, comprehensive, and meets the needs of this community. Thank you to everyone who has played a role in that, end-to-end across all of the organizations, and thank you to the patients who continue to honor and commit to their own wellness and teaching us what they want their healthcare to look like. We are here together, we are excited to open our doors, and we are excited to see what's possible when we all thrive together. With that, I will pass off to Chair Green.
Thank you so much for inviting me to be here. I'm excited to celebrate the reopening of the East Lake Clinic. And I'm also excited to celebrate the new ways in which Hennepin County and the Hennepin healthcare system are deepening our partnership and the work that we do together. It's a wonderful time to be a part of this community, and I want to thank the many staff who are going to be relocating from across Hennepin County to provide a diverse portfolio of services here in East Lake. It represents a tremendous partnership, and you are a crucial part of that partnership. I also want to tell the community that we are here to stay. Hennepin County is deeply committed to our relationship with the East Lake community, and we're so glad to be here and so glad to have you join us in this work today. So a lot is going to be going on in this building that's new and different, many collaborations, and I want to actually look at a list that I have to make sure that I don't leave anything off. For starters, some of the resources that we're going to be providing are mental health resources, our mental health center providing behavioral health services to folks in the community. WIC, Women, Infants, Children, supporting new moms and new babies as they make their way in the world. Adult probation, deepening relationships with community and removing barriers. The Office of Multicultural Services, connecting people with the services at Hennepin County and the services at the Hennepin healthcare system and beyond. And Human Services, connecting residents with the many services that Hennepin County provides in order to continue building strong communities and strong families. So much work going on under one roof. Tremendous partnerships are going to continue to emerge from this. Together, Our goals remain to provide excellent service to you, our residents. We also want to provide that service efficiently and with strong partnerships as represented by what's going on in this building. And we also want to provide good access, a safe and welcoming space, a place that removes barriers to accessing the many services that we provide. So again, welcome and thank you. These goals remain our focus. They have been our focus and will be our focus in the future. We're here to serve you. That remains our North Star. I want to give a big shout out to the many county employees who helped make this partnership happen, to the many community members who have provided your insights and input along the way, to Hennepin healthcare system and other layers of government who have partnered in order to remove barriers to creating these partnerships. And last but not least, to you, the community, for your feedback and partnership. Thank you so much, and thank you again for inviting me to be a part of this exciting event. I'm now going to be handing the microphone over to Commissioner Angela Conley, who represents District 4 on the County Board.
Well, thank you, Commissioner Green. I too am so excited about this project that I made a list. You know, I also recognize the new possibilities that we have in this space. We have a new opportunity here to respond to community needs in a way that we haven't done before. A new holistic way to serve community, to serve patients, to serve clients. Across the county, we've been serving people in new ways throughout the COVID-19 pandemic. This has led us in the direction of new collaboration, such as this one. There are many more ways than ever now for residents to get what they need whenever and wherever they need it. We're working to remove barriers and make it easier to connect with us. And we're working to be more responsive to you, the community. For human services specifically, COVID-19 restrictions confirm to us that we can provide benefits without requiring residents to shoulder the burden of transportation and childcare and time off of work just to come to us. In most cases, people can connect to us by phone or internet, and there is no need to visit a county building at all. For cases where clients do need to visit us face-to-face, they can schedule an appointment right here to do so. They can also access technology, printing, and scanning here and other locations throughout the county. Human Services will also have a team of staff here to help direct residents where they need to go and make sure they know all the options for connecting with us, offer assistance when digital tools aren't an option, and listen to customer feedback, which is so very important to how we move forward. We will use this feedback as we roll out change across other human service centers. We understand that there have been a lot of changes, and not only in our services, but also in the communities across the county, including this one. Through all of this change, however, we welcome residents to find support right here. Our hope for this space is that it supports this community to strengthen and rebuild itself. Thank you to our Minneapolis residents and neighbors for working through these changes and challenging times with us. I'm very pleased now to introduce Dr. Susan Palchak, Director of Public Health.
Thank you, Commissioner Conley. On behalf of the Hennepin County Public Health Department, I also want to warmly welcome our East Lake healthcare colleagues. And if I were to just say, oh, we've been looking forward to this day or looking forward to working with you, that would really be a vast understatement. The World Health Organization defines good health as a complete sense of physical, mental, and social well-being, and not just the absence of disease or infirmity. And the co-location of services here with clinical, mental health, public health prevention, and human services offers us unique opportunities to really address the intersectional needs of community and support that well-being. There's a number of opportunities for collaboration that we're really looking forward to here. Things like sharing of prenatal referrals between the East Lake Clinic and WIC. But it's those opportunities for collaboration, coordination, and patient-centered care, those opportunities that we haven't yet thought about, but that we know that will happen. Those are the ones that are really exciting and give us hope. So for public health, especially the Mental Health Center and WIC, this realignment of space brings us steps closer to better meeting the needs of community especially those experiencing significant health disparities. So on behalf of the Hennepin County Public Health Department, I thank you, and let's get to work.
Gracias, doctora Palchak. Vengo hoy con profunda gratitud a mi comunidad de la clínica de Hennepin Healthcare East Lake. Quisiera expresar mi profundo agradecimiento a los benefactores, partidarios y colegas que forman una lista de nombres demasiado larga de contar, pero sepan que su dedicación de tiempo, energía y fondo siempre será recordado. Todas las gracias a los comisionados del condado de Hennepin, especialmente a Marion Green y Angela Conley por su atención a la salud de la comunidad de Hennepin y East Lake. También doy gracias al liderazgo de Hennepin Healthcare, Jennifer de Cubelas, Emily Bloomberg y Chris George, por comprometerse con recursos para reconstruir la clínica de East Lake y haciéndolo una realidad. Agradezco a nuestros queridos empleados de East Lake por apoyarnos unos a otros durante este tiempo de mucha dificultad y cambio. Sus voces promovieron la comunidad de East Lake y sus millones de acciones de agradecemos profundamente a cada uno de ustedes. Gracias a todas esas manos colaboradoras por ayudarnos a limpiar el caos, por donar artículos y comida, por hacer entregas, por prestar el oír y escuchar a los que necesitan ser escuchados y brindar guía a esos que se sienten despojados. Y por tomar la iniciativa de celebrar cada logro, grande o pequeño, por brindar nuevas ideas, comentarios y dedicación. Así el gran trabajo en estos últimos 16 meses. Su gran dedicación y motivación ha sido un gran orgullo de poder compartir con todos ustedes. Un gran agradecimiento a mis colegas, proveedores y Ryan Ermeyer, el gerente de East Lake Clinic, por sus ideas, su devoción y su pasión de enfoque compartido hacia la visión de nuestra comunidad. A pesar de tantos cambios radicales, ustedes demostraron una flexibilidad increíble que demuestra la compasión y devoción que tienen para nuestros pacientes. Damos gracias a nuestra valiente comunidad de la clínica de East Lake, los de hoy y antes. Es por ustedes y para ustedes y acerca de ustedes que tenemos esta visión de proveer salud y bienestar para todos aquí presentes y sus seres queridos. Sin ustedes, este sueño no sería realidad. Una vez más, la familia de East Lake se los agradecemos a todo corazón. Gracias a la Fundación de Bush por compartir y confiar en nuestra visión de traer cuidados de salud y superar el trauma. La nueva clínica de East Lake está siguiendo un camino de sanar traumas y enfocar de cuidados hacia la sanación de traumas. Cada paciente siguiendo este modelo es una participante de su propio proceso de sanación. Estaremos desarrollando un proceso que ayudará a aliviar y a superar las consecuencias de trauma, como lo siguiente: crear relaciones entre pacientes, empleados y comunidad, comunicar y expresar las voces de experiencias diferentes de cada uno, dar a cada paciente el poder de formar parte de hacer decisiones de salud. Informamos cómo podemos apoyarnos mejor, proveer enseñanzas y a los pacientes y empleados sobre la prevención y reconocimiento de la aumentación del estrés de trauma. Asociarse con la comunidad de nuestros para formar intervenciones más holísticas que incluyen la mente, el cuerpo y el espíritu. La clínica de East Lake ofrece servicios primarios a más de 9,000 pacientes que vienen de todos los vecindarios de la comunidad diversa de Minneapolis, que tenemos tradición de dar servicios en diferentes idiomas, culturas, niveles sociales y creencias. Por esta gran diversidad es que surgió el sueño de proveer cuidados hacia la sanación del trauma para nuestros pacientes de East Lake. Por este medio podemos crear una existencia en armonía de equidad en la salud, el bienestar, sanación y sensibilidad cultural. Estamos aquí hoy como testimonio de que la clínica de East Lake no solo está reconstruyendo, sino que también está ayudando a transformar la atención médica hacia lo que siempre ha sido capaz, sanar.
Thank you very much, Dr. Coca. Chris George here, your Senior Director of Primary Care, and I am so happy to be here to welcome this beautiful new East Lake Clinic into our network of community clinics. You know, all of this work could not be possible with some key partners that were involved in the construction. From the planning and architectural drawings, HGA, they've done such beautiful work for all of our facilities, and they have not disappointed with the new East Lake Clinic. Knudsen and all of the subcontractors that they've employed to help put the facility together. Henriksen, our furniture partners, Archetype, Beltman, they move our furniture in and out of this location. Braun Intertech, Dorsey Hovde Art Design. And of course, it would not be possible without some key internal partners, our IT department, and most importantly of all, our facilities department, who coordinated all of this work. With this new facility coming up, one additional individual that I'd like to personally thank, Ryan Erdmeyer, our manager. I know, Ryan, you were very disappointed when the old East Lake Clinic was destroyed through the social unrest, and how happy you were when we decided to rebuild. With that, I will hand it off to you to give us a few words. Ryan?
Thank you, Chris. From day one, we knew we were committed to returning to the East Lake neighborhood. So much so that we posted a banner on our old clinic telling everyone we were coming back. And this is that moment. We are back in the neighborhood. We could not be in this position today without the support of so many, including our very own Whittier Clinic, who opened their doors to us immediately after the clinic was destroyed. They have been such welcoming hosts to us and our patients. We are also honored that our federal leadership in Congress, Congresswoman Ilhan Omar, and our U.S. Senators Amy Klobuchar and Tina Smith have included the East Lake Clinic in their appropriation requests at the federal level. This acknowledgement from our leadership speaks volumes to the importance of the East Lake Clinic here locally, and the impact this clinic can have as a model for the country of what an integrated, equitable experience in healthcare can do for our communities. Thank you again to Congresswoman Omar, Senator Klobuchar, and Senator Smith for their support. And finally, we can't thank our donors enough for the contributions that made it possible to immediately respond to urgent patient needs like food, hygiene supplies, and transportation from the East Lake neighborhood to our clinics. I wish to share a special thank you to UCare for the use of their mobile clinic during this time. Your generosity and gratitude are more welcome than ever as we embark on a new patient experience. Art sponsorships will bring beauty and are selected in partnership with our patients and reflecting their cornerstone values while supporting local artists. Exam room sponsorships will boost our healthcare environment. Our Hennepin Healthcare Foundation is at the ready to connect the generosity of the community with our work at East Lake Clinic. We are forever grateful.
1, 2,